Hi, my name is Michael White and I'm a doctor of physical therapy. Today we'll be reviewing exercises for neck pain. It's important to note that neck pain is episodic and reoccurring in nature, so you want to remember these exercises for the duration of your life. These exercises will be performed typically daily, which will improve your neck pain. If at any time you have any questions related to your recovery during the process, it's important to note that you want to consult a doctor or your physical therapist for any updates on your response to these exercises. Lateral flexion or lateral bending is typically an exercise that involves bringing your ears down towards your shoulder. This exercise is usually performed towards the side of pain or potentially away. Again, you're going to want to consult your physical therapist to determine what is appropriate. Lateral flexion involves bringing your right ear down to your right shoulder and then coming back up. Again, you can repeat this exercise about 10 to 15 reps and then take a break. You're not going to want to hold for a stretch, you just want to repeat on and off. Typically done every 2 to 3 hours if appropriate. The next exercise we'll be reviewing is what's called retraction, more commonly known as a chin tuck. A chin tuck involves taking your head and moving it posteriorly as if you were trying to pin your head up against a wall. I'm going to demonstrate how you do that exercise in a second. That exercise will be performed in reps of 10 every 2 to 3 hours because again, it's more about the offsetting of all the forward motion that you do while sitting or looking down at your cell phone. Retraction is completed bringing your head backwards and then coming forward, attempting not to move your shoulders while doing the exercise. If you feel like you need a little bit of help, you can use your hand to assist with the motion. An exercise that is sometimes used for symptoms that are radiating below the elbow and into the hand, which will target the lower cervical spine, is what's called a chin tuck with lateral side bend. This exercise involves giving yourself a double chin and then bringing your ear down towards the side where you might be feeling the symptoms. It is a normal response for that symptom to potentially increase as it comes up your arm. That's called centralization. If you feel that you can get a little bit further, you can use your opposite hand to push and then repeat and come back to midline. But again, you want a centralizing symptom. You should perform this exercise 10 reps, typically every 2 to 3 hours, as deemed by your physical therapist. An additional exercise that we will be performing is called retraction with extension. Retraction with extension helps to achieve end range extension of your neck, which can help with acute neck pain. But again, you should always consult with your physical therapist to determine if you're appropriate. I'm going to turn to the side to demonstrate the exercise so you can see. The first step is retraction, so all the way back, and then all the way up. Each time, trying to go a little bit further. If you need support, you can use a towel. To assist. These exercises are typically performed in reps of 10 and performed every 2 to 3 hours. A postural strengthening exercise is called scapular retraction or a scapular squeeze. I'm going to demonstrate the exercise by turning my back. While sitting up nice and tall, squeeze your shoulder blades together and then return back to neutral. Squeezing together and then coming back to neutral. You're going to want to imagine that the inferior angles, so the lower part of your shoulder blades, are coming together more towards the spine in the shape of a V. You'll complete this exercise in 3 sets of 10, about 2 to 3 times per week. Sometimes a self-assisted thoracic mobilization is an effective tool to help treat your neck pain. You'll want to consult your physical therapist to determine if this exercise is appropriate. I'm going to demonstrate here with a foam roller. Typically, the exercise is performed while sitting on the ground. You're going to turn and be perpendicular to the foam roller, as I am now. Start with the foam roller about the upper 1/3. Put your hands behind your head, but will remain supported, and simply extend as far as you can over the back of the roll. You can either adjust or move the foam roller higher up as needed, and again, extend over back of the foam roll. This exercise will typically be performed about 10 to 15 reps, maybe once or twice per day. Thank you for watching the videos that may help to assist with self-management of your neck pain. Again, it's important to note that you're going to want to consult your physical therapist to make sure that you're starting the exercises appropriately, you're going slowly through the progressions, and monitoring for any adverse reactions during the recovery process.